Good day everyone, my name is Garcia, a second-year nursing student from Section II-WIEDENBACH. So for today's video, I'm going to share the mechanism of labor. Mechanism of labor, or also known as cardinal movement, is the ability of fetus to successfully negotiate the pelvis during labor. It involves changes in position of its head during its passage in labor. Passage of the fetus to a birth canal involves several different position changes to keep the smallest diameter of the fetal head in cephalic presentation, always presenting the smallest diameter of the maternal pelvis. These position changes are termed the cardinal movements of labor: descent, flexion, internal rotation, extension, external rotation, and expulsion. The mechanism of labor starts in an engagement wherein the fetal head of the fetus passes through the pelvic area so that it will level on the ischial spine or zero station. The fetal head enters the inlet of the maternal pelvis as well as the sagittal suture of the fetus or the fetal head and the transverse diameter of the maternal pelvis. As labor progresses and contractions getting stronger, there is a fetal axis pressure. The pressure of the uterine contractions pushes down to the sacrum, and it makes the fetal head flex, which results in the smallest diameter of the fetal head presenting in the occipito-brachmatic diameter. As labor continues to progress, there is an increased pressure down the fetal axis caused by an increasing strength uterine contractions, and it causes the fetus to descend into the maternal pelvis. So as the occiput makes the resistance on the maternal pelvic floor, internal rotation occurs. Due to the shape of the maternal floor, it causes the fetal occiput to return continuously for about 1/8, and as the descending of the fetal increases, it causes the occiput to slip beneath the suprapubic arc of maternal pelvis, wherein crowning can occur. The fetal head pubis on the sub-occipital region extends and releases the sinciput, face, and the mentum or the chin, which sweeps on the perineum. After that, the fetal head is free to do something which is called restitution. It is when the fetal head and fetal shoulder realign and there is the untwisting of about 180 rotation. At the same time, there is an increasing descent of the fetus. Now, the anterior shoulder makes the resistance of the pelvic floor and rotate about 1/8 anteriorly. You get an increasing descent, anterior shoulder sweeps underneath the pubic couch, and posterior shoulder slips into curve of the hollow of the sacrum. So with that, expulsion occurs, causing the remainder of the fetal body is to be delivered. So that is the mechanism of labor. Again, this is Garcia, a second-year nursing student from Section II-WIEDENBACH. Thank you and God bless us all.